So, hello everyone. Welcome to the radiology class. So, today is our first class. Mm, Okay. So, today is our first class in radiology. So, basically, whoever practicing in electrohomeopathy or alternative therapy or mainstream medicines like electrohomeopathy, homeopathy, Ayurveda, Unani, or MBBS doctor. So, whoever practicing in main medicine nowadays, it is very important to see the internal structure of the organ to diagnosis, or to say, to do complete diagnosis. We need the help of radiology. Okay, so it is the truth and it have to be accepted. Okay, and second thing is that the radiology subject is also important nowadays, because nowadays degenerative diseases are very common. Okay, like if you want to know the status of your lumbar, sacrum, or cervical, or knee joint, back joint, or neck joint, you have to do proper diagnosis. So, which part of the body is affected, you have to know the radiology knowledge. Then only you will able to diagnose the condition of the patient, and you will give the proper treatment. Okay, but whenever required, then only we have to advise the patient, not for like it is not a commercial way to advise a patient to uh, to do a business. Okay, but we have to properly use this tool. Okay, nowadays most of the doctors use this tool as for business purpose also. So uh, it's my request that after learning radiology, okay, whenever, if you are unable to diagnose the patient from their symptoms, okay, from the, in electrohomeopathy we have a best diagnosis, that is temperamental diagnosis, and we have pulse diagnosis. Nowadays tongue diagnosis also is there, and other than that we have eye radiology. So after using all these diagnosis steps, if you are unable to find out the problem within the patient, okay, so we have to advise the patient. Okay, so let's start the class. Mm, why it not working? One second, please. So radiology is a subject with that we will do the diagnosis. For the diagnosis purpose, we use this tool. Okay, so basically we have medicine. Medicine means which protect us from the disease, which treat the disease, okay, which also tells us the information about the disease. Okay, this is the medicine. But what type of disease occurs? Okay, is there structural problem is there, and which area is affected? So you have to take the help of radiology. Radio, here we have the two words radio plus ology. Okay, radio means here waves. Okay, with the help of waves, okay, we will study the body, internal organs. Okay, frequency. Okay, so this is the basic thing. So radiology, we have different two types. Okay, and first is for diagnosis purpose. Okay, and for treatment purpose. In some cases, we use this tool mostly in modern medicine. Okay, the radiology is not only helpful for the diagnosis, it is also helpful for the treatment purpose. How? For diagnosis purpose, we see the structure, okay, inside the body, to see the structures inside the body. So like example we have x-rays. So when doctor advise about x-ray, so he will write chest x-ray. Okay, okay, with the help of x-ray, we are able to study the inside the chest. What are the organs we have inside the chest? We have lungs, we have heart. Okay, about two organs. So when will doctor advise chest x-ray? He will advise chest x-ray when you have cough, uncontrolled cough, or breathing difficulty, any problem related to lungs and heart. So initially, doctor will advise chest X-ray. Okay, this is the basic X-ray. So what this is for diagnosis. So after doing lungs X-ray, okay, lungs X-ray, what will the after seeing the lung X-ray, so we will get either normal. So if it is no problem is there, it is nothing, any internal structure is not changed. So the radiologist who studied about the specialization, okay, they will give the report that is normal. Okay, if there is a problem in that particular area, so he will write the patient have bronchitis or pneumonia, pleural effusion. Okay, so there are some diseases. Okay, he will write in his impression. Okay, so you will get the diagnosis. Now, what will happen? Bronchitis is a problem of bronchioles. Pneumonia is an infection. Pleural effusion is the excess fluid accumulation in the pleura. So all these different methods. Okay, but it is not same. Bronchitis is different. Pneumonia is different. Pleural effusion is different. Okay, with the help of what you will decide. Okay, this problem is there in that patient. So I have to treat and advise the patient. Okay. So this is how first radiology will help you to do the diagnosis. Next is for treatment person. How treatment perspective. We have it is newly invented. Not newly means recently. Some years ago it invented. That is interventional radiology. Interventional radiology. What is interventional radiology? It is a form of tool with the help of machines, with the help of tools. Okay, we will go with the help of machine inside the body. Okay, and we will diagnose the problem, and at the time of diagnosis only, what we have, we will repair that problem. Like nowadays, you will able to see the angiography. Angiography, it is a study or it is a tool of radiology in that the arterial system of heart is examined. Okay, and if any blockage occurs, so if the attenders, patients attenders and patient family members are willing to do a shunt surgery, so at the time of scanning itself, doctor what will do, it will make a shunt at that blockage. The shunt will give some space for the flow of blood. So this is called interventional radiology. What is called interventional radiology. But in the diagnosis tool, we cannot able to treat the patient like in X-ray. Okay. So these are the things. Next is next example. We have calculi. Nowadays, renal calculi or re- renal calculi or gallbladder calculi. Okay. We have that surgery. Okay, that will blast that the uh, stone, that is with the help of radiology itself. Okay, so this is how biopsy is not a interventional radiology, but it will conduct in diagnostic. Biopsy is taking a piece of affected area, and we are sending to the microbiologist that please see this piece of human body. In that, what type of microorganisms are present, any cancer cell are present, or any type of tumor is present, etc., etc. Biopsy is that you are sending one part of the cell. Like a person have buccal carcinoma, mouth cancer. So what the doctor advised, that will the biopsy means the extra amount of piece which came to that area. So doctor will advise that we will cut that piece and we will send to the pathological lab, and the doctor of pathologist or microbiologist, okay, biochemist, okay, they will do a research on that, which type of bacteria, microorganism, or cancer cell, tumor cell is present. Okay, that is biopsy. So we are on the basic things today. So this is called intervention radiology. So basically, radiology is the invention. Okay, radiology is a invention. So how is invented? When is it invented? Let's talk about that. So basically, in 8th of November 1895, Dr. R.C. Rantigen. Okay, Rantigen. Okay, he is the father of uh, radiology. W.C. Rontgen. Okay, it is a he is a German scientist. Okay, in 8 on 19 8, 1895, sorry, 1895, he invented the X-rays. What he has invented? He has invented X-rays. That is not purposely, but uh, not directly he invented, like he want to invent x-rays, now he's doing research. Okay, so without knowing anything he invented x-ray. So what happened that he is doing some research in Crookes tube. Crookes tube is a tube. Okay, in that we have positive, negative, cathode, anode. Okay, whoever studied physics they will know that. Okay, so in that he is doing something, he want to know about that how he's working, etc., etc. But when he doing research on the tube, Crookes tube, so unconditionally one type of rays is generated from that area. So the rays is generated when he is putting his hand, the rays is passing through his hands, cardboard, everything. So uh he want to know about that. He what is that? He try to want to know that. So after that, he identified that they are X-rays, not X-rays. He don't know what to give the name. So that's the reason we will tell that person, those persons. So that's like XYZ. Uh, Scientists mostly use XYZ. Okay, if unknown things are invented, so he gave X rays. Rays are coming from that part. So X rays. Okay, so he is the father of radiology. Who is the father of radiology? W.C. Rontgen. Next, two scientists who invented CT machine. CT machine, we will discuss everything, but here I am telling the basic things. That is Alan Cormack, okay, and Godfrey. They invented CT machine. MRI machine is invented by Peter Mansfield and Paul C. Lochbohr. Okay, we studied about intervention radiology. That is discovered by Charles Duter. Intervention radiology. Okay, and different doctors, different uh, they invented. Okay, so it brings more development in the radiology. Okay, but the person who invented x-rays is the basic person, starting person who invented. So later on the research is going on. Now also research is going on. Okay, so different types of CT machines, x-ray machines are there. Okay, so this is the thing. So I think today is the basic class. So gradually we will increase the things. So I think today is enough for this. So anyone have any questions? Kindly ask.